Good morning to you, and good morning to our listeners and viewers. How are you doing today?
I'm good. I'm good. I feel like it's been a little while since you've
I
been in
know.
studio.
Always feels that
And I also know this is your birthday month. So
Yes,
I,
it
I
is.
forgot to wish you happy birthday last week on the show. So it's never too late for birthday
Thank
greetings,
you.
right?
Appreciate it.
Yes. So belated birthday
Yes.
wishes to
Thank you.
Jacinfa.
Thank you.
Jacinfa, do you celebrate the entire month of
The
November?
entire month.
Okay. All right. So people who encounter you for the rest of the month, if they didn't know it was your birthday month,
Yes.
they
Yes.
still have the
Of
opportunity
course.
to.
Of course. I
Right.
welcome all the blessings.
Right. Of course, welcome to and good morning to all our regular listeners, our social media listeners, people who pop on the Facebook page of Q95 FM and the YouTube channel of Q95 FM. Good morning to you guys. I see you guys popping on. Always a pleasure to have you. If you're joining us, of course, on radio and you're always listening silently, good morning to you. I know we have quite a few listeners who never call, they never send a social media message, but they locked onto the program every Wednesday. So good morning to you guys. Julie, good morning to you. I see you guys starting to come on. Jacinfa, I know there was this of course is Diabetes Awareness Month. And I do know that last week on the program, we spoke about a clinic, diabetes clinic that was going to happen in Portsmouth. And I want to get all the details on that. We do have Dr. Jolly in the house this morning with us. And we do also have Coralie Thomas in the house with us this morning. So I want to get from everybody what happened, what was popping, what was going on in that health clinic put on by Jolly's last week.
Yes.
Yes. So this week we are continuing with our discussion on diabetes, and we have ladies in the house to assist us with that. Dr. Jolly returning and Coralie coming on today with us. So if you're listening and you want to know what are they talking about on Health Vibes? What are they going to be talking about on Health Vibes? Our topic today is diabetes, but specifically we're taking a nutrition slant in our discussion. Dr. Jolly, the clinic
Yes, good morning. Good
last
morning.
week, yes, good morning. To just continue off from where we left last week, how did that go?
The clinic was very good. We did it at the Jollies in Portsmouth.
Uh-huh.
We were ably assisted by the American Canadian School of Medicine. I must say the students came out and they put on some good the education. They had a table that was dedicated to checking people's blood pressure and their blood sugar. They had a table that two tables actually dedicated to education. One where they provided educational pamphlets concerning diabetic foot care, nutrition, and they also had another table like we have set up here where they had cucumber and plantain and showing people the amount of sugar in sodas and juices. So I was really impressed. The other thing too is that I had been 2 years ago, and there was a small group of students. I've noticed that the number of students has grown, but also what they put out had, in my opinion, had significantly improved. And so I would really like to, thank the faculty and the staff for assisting the students and having them come out there. And I just thought that what they did was wonderful. We had a good time. We gave away some prizes. We checked some sugars and blood pressures. We admittedly, yes, we admit that we would agree if we'd like for more people to come out, but we were happy with the turnout. I spoke a little bit in terms of education. One of the other pharmacists, Edgar, spoke about his own personal experience with diabetes, and so it was really nice. It was all good.
Okay.
And then apart from that particular clinic in Portsmouth, for the whole week at all the branches, we had free sugar and blood pressure and monitor testing in all branches. So it was throughout the week and then it's community at Portsmouth.
So are people taking the opportunity to have their blood glucose
Well,
tested at the pharmacy, since you all have had that
well,
going on for
yes,
free?
of course, they
Yes.
took advantage of it, and
Okay.
I mean, it's an everyday service.
Mm-hmm.
It's just that the last week,
Mhm.
you could do it for free.
Right.
But it's an everyday service. Anyone wants to come in and have their blood glucose and blood pressure being tested and consulted we have it available.
Okay. All right. Nice. So good to hear that the clinic, the Portsmouth diabetes clinic went well, and of course World Diabetes Day was on the 14th, and I did see quite a lot of buzz on social media, and of course from the Dominica Diabetes Association as well, in commemoration of the day and to raise awareness about diabetes, as we are doing here on the program Health Vibes as well. We have someone else in studio. I mentioned Coralie Thomas is with us in studio. No stranger to Health Vibes. Always always listens to the show and has also been on the show before, with a background in nutrition. Coralie, let me allow you to introduce yourself. Good morning to you.
Good morning. Good morning, and good morning to my colleagues in studio and to the listening public via whatever platform you're listening. I am Coralie Thomas. I'm a nutritionist by profession. Has been, and by the way, happy belated birthday to you.
Thank you.
It continues, right?
Yes.
I've been a nutritionist for over 20 years. Trudy, as you may know, I studied and worked most of my career in Canada. I'm currently working with the Ministry of Education as the national nutritionist. So that is me in a nutshell.
Welcome.
Thank you.
Yes, and I know last week on the program we had a pediatrician on, and with Dr. Jolie, and we started to talk a lot about children and practices that they should engage in to sort of prevent this increased incidence of diabetes that we have recognized we're seeing in our population. So we did do quite a bit. So of course, from the background of you being Ministry of Education, I know we will get into some of that discussion as well. And today on the program, we have a big giveaway, a big giveaway.
Yes, indeed.
Yes, we have a big giveaway. We just we need to be able to take some calls to give away this big prize that we have. But Jolly's Pharmacy has sponsored a very nice package geared towards the management of diabetes. So if you're viewing on our social media platforms, Q95 social media platforms, you can see. But just anybody, you want to tell them what we're giving away this morning, what we have in studio to give away, and all compliments Jolly's Pharmacy. Yes.
So as Trudy nicely mentioned, this is a very well put together diabetes care package. So first, it has a blood glucose monitor. Along with it has the Lancet. So this is what you use to get the blood, so you can test to see your levels. It has a bottle of Glycerna, and this is a drink specially formulated for those suffering from diabetes. It also has a box of cinnamon mint tea bags, and you know that cinnamon plays a crucial role in regulating blood glucose levels. And in addition, it has a very good size of 7C's cod liver oil plus omega-3 fish oil supplements. So it's a well thought of, well put together package, and one lucky caller will be entitled to this package. So tune in, listen, and I hope you listened to last week's program. So stay tuned.
Yes. So we will, when we open up the lines, we will be asking a question based off of last week's program, and trying to get someone to win this package. Compliments Jolly's Pharmacy, that is in line with management of diabetes. So we will be taking some calls. We just need to get things organized here in studio before we can do so. But don't be, don't give up. we will be we will be taking calls. But you have to answer a question about last week's program and some of the information that we disseminated. So get your information on so that you can do that. Okay, so this morning we have the nutritionist in the house, Dr. Jolly, who I like to call the diabetes doctor, is in the house. And so we want to continue talking about diabetes, but particularly from the standpoint of nutrition. So I want to get the ball rolling and ask, first off, someone gets a diagnosis of type 2 diabetes and it seems overwhelming right away in terms of restrictions. People may feel it's so restrictive. I cannot eat this. They're saying I'm not supposed to eat that. I want to know from the perspective both of Dr. Jolly and of you, Coralie, how does somebody newly diagnosed start to approach a nutritional plan to manage their disease?
Okay, I will give Dr. Jolly, you want to go first, or you?
I'll let you go.
Okay. So if, for example, as you said, someone come to me saying that they were referred from their doctor to see a dietitian or nutritionist with their diagnosis, first of all, the doctor will give them some idea of what they can and cannot have. And then when they come to me, based on what the doctor diagnosed them with, I will do a meal plan to facilitate their diagnosis. But always, as a nutritionist, I go from referral from the doctor. And even if you're seeing me, I'm working with you, I will let you go back to your doctor and say, well, this is what the nutritionist and I will come up with, and we work with it. And then the doctor will always be monitoring whether it's working or it's not working along with me. So then in that case, the doctor knows if she should increase your meds or if she should decrease your meds or if something else needs to be added. So from a nutrition standpoint, that is always how I go about it. And there's never once will I tell a patient, do not take your meds that are referred to you by your doctor.
Okay.
We have to monitor your situation. I am not a doctor, I'm just a nutritionist. The doctor is above me. So we always go by what the doctor says. And when you have your team working with you, your nutritionist, your doctor, your nurse, your pharmacist, everybody's among your family members, then you can better mitigate or prevent whatever the diagnosis is.
Dr. Jolly, from your standpoint, newly diagnosed patient.
Oh, okay. So, as doctors, we understand the importance of nutrition when it comes to managing diabetes. Unfortunately, most doctors do not get much education when it comes to nutrition, and so in today's age, we are woefully lacking in terms of being able to advise. And there's a lot of nutrition misinformation out there. So a lot of the information that I have acquired actually was after my training, and it was actually an introduction to nutrition that led me to diabetes and understanding. So one of the things which I think Dr. Thomas brought, which was the plate model. Oh, nutritionist. Sorry. Oh, um, what one of the things which she brought was the plate model. So one of the things that I like is that one, it's an actual plate. I have pictures in my office which I show, but this plate demonstrates exactly how everybody, because actually there is no diabetic diet. There's no diabetic diet. So I provide some nutrition information in my office because most folks don't have they would have to make a separate appointment and pay a separate visit to see the nutritionist. So I try to give them some information that they can take with them to help manage your diabetes. And so this model shows that half of the plate should be fruits and or vegetables, mostly vegetables, non-starchy vegetables. And so some of the examples here are carrot, avocado, broccoli, lettuce, and there's like a little strawberry. But some people do put fruit in their salad. And so I encourage folks to have they could do fresh vegetables or they could do steamed, whichever one they like. The other half of the plate, as our viewers can see, is divided into two. Um, so a quarter of the plate, that's your meat or your fish, which is the animal protein, and the other quarter is the carbohydrates or starch, which could be rice. You have something there that looks like a potato. One of the things that I like about this plate is that it says here, enjoy your food, eat slowly. So don't eat too quickly so that you enjoy your food. And that you have the power to change yourself. So you have some ready-made affirmations on this plate. So I like this one, but I also like this bowl as well, and it has somewhat the plate model. So I'd like her to explain because I've not seen the bowl. I've never seen it in a bowl. It has some of the same things in that half of the bowl is vegetables, a quarter is protein, and another quarter is carbohydrate. But how do you achieve that in the bowl?
I think the idea for the bowl is the serving size, the portion size.
Okay.
I think that's where the main focus is. But the as you said, it shows the same as the plate with the carbs, the protein, and whatever. But the whole context of it is the portion size.
Oh, the portion
The
size.
portion size.
Okay,
yeah.
so if somebody's having some broth, is that how much broth they should have?
Well, you see, it says here it goes from a cup and a half, 1 cup, 3/4 cup, a quarter cup, or half a cup.
Okay.
So according to the serving size, which a serving size is 250 ml or 237, depends if you're using the American or the other serving portion guides. But what I find as a nutritionist is that people tend to overeat. And usually we have the serving size in our kitchen with 1 cup, the same thing, quarter cup. So when we go to the restaurant, especially if we're eating out, that is where we tend to overeat. They don't usually use the ideal serving size. So that is the idea that if you're in a restaurant or even at home, you go according to the serving size, which will prevent you. And especially when it comes to diabetic, portion control is very, very important. Okay. So that was the whole idea of the bowl.
Okay. And for people, of course, who are not on social media and cannot see and they're listening to us, the bowl that we're referring to, that Dr. Jolie and Coralie Thomas was referring to, is a pretty small bowl. It's maybe comparable to a cereal bowl that you would have. And it is segmented to show the quantities of the different foods, carbohydrates, protein, and vegetables and fruits that you're supposed to have, as well as the plate, a segmented plate or portioned plate. But I will let you know, for the people not viewing, that both the plate and the bowl are moderate in size, or you know, so they're small. Yeah, I want it to be nice if they would moderate, because a lot of us, our plates are much bigger than that, and our bowls, if we're eating food in a bowl, is much larger than that bowl. So it just goes to show, you know, Coralie, like you were saying, portion sizes are often overdone.
I wanted to make 2 points. So based on the plates, so Dr. Jolie described that half of the plate is supposed to comprise of your fruits and vegetables. However, many of us, when we dish out our meals, the vegetables are garnished. So we sprinkle, a little parsley or so, and probably a very small portion in the corner. But if you really have to follow this guideline, you'd realize that we do not portion our foods properly, and we overeat the wrong choices, and the portion sizes are very, very inaccurate.
Yeah.
We are taking a call. We want to hear this caller. Caller, good morning.
Hey, good morning, Trudy.
Hi, good
And good morning to
morning.
Dr. Jolly, and good morning to all the rest
Good
in the
morning to
studio.
you.
Mm-hmm.
Yeah, I just I listening, but because you mentioned about the bowl part, I just viewed and saw the size of the bowl.
Okay.
And really and truly, very important information, because what I realized, you said when you started off that the part you are going to deal with today is the nutritional part of diabetes and the diabetic condition. And that is a very important point from inception, because if the diet was all right and everything was all right in the first place, there would not be diabetes. So I want to take it from the perspective where the bowls, the serving size that you're showing, a lot of people don't even eat. That's not enough for a lot of people, because people eat to full their stomach and not to nutrify themselves. So what you find is people always have big platters in front of them. The more the merrier. And it's not about with me personally, food if food is medicine, then you cannot be eating quantity. You have to look at quality.
Mm-hmm.
Right. So one of the things I have done in my own research, right, nutrition and food is important, and serving size is important. With that condition of diabetes, or you have, there is statistics that show that a lot of diabetics are actually deficient in key minerals, magnesium, zinc, and vitamin B12. Now, if you're not eating a proper diet that has these things, well, you're supposed to be eating a balanced diet where you're getting everything, but people really don't eat so. People eat what they like. I mean, you have people that growing up children, and because of what they expose the children to, they're telling you their children don't like this or doesn't eat that. But you are the one that didn't actually introduce your child to what is right or what is nutritional to their upbringing and their health. So, because we have doctor here, we have nutritionist here, I want you to prance on that information, the nutrition deficiencies in people with diabetes, especially magnesium, zinc, B12. Have a good day.
Okay,
Thank
thank
you so
you.
very much.
Thank you. Thank you, Paula. Oh, let's just take one. Let's take another call. Caller, good morning.
Good Wednesday morning to you all. There's any men in the house?
The
morning.
producer is a man. He's in the house. Yes.
Yes, I just want to say a pleasant good morning to all the ladies, beautiful ladies in the house, the gentlemen, and good morning to Dr. Jolly, and Jeremiah is into.
No, Leona is not in. Jacinta is with us this morning.
Okay.
Mhm.
My name is Marley number 1007 Boom Betush. I just want to take this opportunity to say belated, happy birthday to my darling Dodo Jacinta.
Thank
I
you.
want to wish her all the best, love, peace. I'm asking the Almighty Father to protect her, guide her, give her more wisdom, more power, more money in her pocket, more food on her table, and I want her to take care of herself, which she always do. And Miss Jacinta, I wishing you all the best. And ladies, keep up the good work.
Thank you.
God bless
Thank you
you all.
very,
I
very much.
always listen to you all, reach for the star, and never give up. And this is for you, and especially to the birthday lady Scorpion.
Thank you.
Boom,
Thank
boom,
you.
boom.
Thank you, Marlene. Okay, so ladies, we were talking about. Well, we had one question from or one ask of a caller to delve a bit into the nutritional deficiencies that a diabetic may experience, and then we were also speaking about serving size, portion control. I had a question for you ladies as well as it relates to non-starchy vegetables, Dr. Jolly, which you mentioned, some clarity on what are starchy vegetables for the general audience. And I know, Justin, for you were also midway in your point when we started taking calls. So we have the nutritional deficiencies to speak to, the non-starchy vegetables, and some classification there. And Justin, to continue your point.
Yes. So the other point I was going to make is that while we are discussing the types of foods, the different portions, how we should eat them, when we should eat them, we have to remember that these guidelines are not only for those suffering with diabetes. It is not for only those who have suffered complications because of this condition. Anyone, whether you have been diagnosed or not, if you do follow those guidelines, you will live a much healthier and longer life. Do not wait until, God forbid, you are diagnosed with this condition to adhere to those guidelines, because we are talking about health and nutrition, and it is for everyone from children to adults. So do not say, okay, this discussion does not put into me and I may not benefit from it. No, this is an overall guideline. Yes, most beneficial, or how should I say, diabetes should for sure follow those guidelines. But again, it is not tailored only for them. It's for everyone. Yeah.
Okay. Yes. Who wants to take a stab at the nutritional deficiency question, and then the non-starchy vegetable question?
Well, the nutrition deficiency, not only in diabetics, as our pharmacist just said, it's across the board. Because and a lot of time what you find, especially with diabetics or hypertensive patients or cancer, whatever it is, patient that you diagnosis you may have, you find a lot of time there's restrictions on what you should eat, which as a nutritionist, I don't, as you rightly said, there's not a diabetic meal per se, but is how much you eat, when you eat, and what you eat, and especially with the portion control. I'll give, for example, patients will come to me, or clients will come to me, and they'll say, well, I'm diabetic and I was told that I shouldn't eat bananas, I shouldn't eat mangoes, I shouldn't eat no fruits or vegetables that is sweet. For me, that is not my practice. That is not what I was taught. If you're a diabetic, and yes, we know we have foods that are high GI, which is our glycemic index, and we have food or vegetables that are lower, right? So that is why for diabetics, when you come to me as a client and you said that I was told by whomever it may be that I shouldn't be eating bananas, I will push that aside. I will debunk that right away. What I will tell you is the type of banana, because you have the banana ripening in stages. So if you eat a banana like this, and again, we have our bananas comes in different sizes. So I will encourage a diabetic, when you go to the grocery store and you're doing your groceries, try to buy the smaller bananas. If you don't get the smaller bananas and the bigger ones is available and you want your banana because you have your potassium and whatever else nutrients you're getting from it, eat half of the banana. If you eating mangoes, and let me just put it on the record, I am a reverse diabetic for over 20 years.
Wow.
So, and another thing about a myth about diabetes is that people think once you're diabetic, you're obese. That is not the case. There's people that is bigger than me and healthier than me that is skinnier than them. So it's not a one size fit all. So this is some of the things. And a lot of time you will find people are lacking nutrients because they don't get the knowledge, the proper knowledge, or they don't understand the proper knowledge. So they will be putting away the bananas. And then when they go back to the doctor will say, well, your magnesium is low, your potassium, or they go to the pharmacist. And then when you start talking, you find out, well, I haven't eaten bananas for 6 years because I was told I'm a diabetic and I shouldn't eat bananas. Mangoes are very good with digestion. People in Dominica who can say they don't eat banana, they're not going to eat mangoes.
Especially during mango season.
Especially during mango seasons. What you have to do is if you have a big mango, again, you eat half of the mango or eat the smaller mangoes. You don't sit down and eat 5, 6, 7, 8, 9, 10. I have to say sometimes I cross the limit. I'll start with myself, but I know my limit. And I think there's a reason, Doc, why God created these fruits as seasonal. Because, if people like me had to eat mangoes all year, then I would be at the doctor's office every day. And I'm just going to leave it like that. But then again, it's in moderation.
Okay.
And the caller is right. We are lacking a lot of nutrients, not just diabetics or any other diagnosis, but on a whole. Because we tend to think that this is not good or this is not. All foods are good. It's your portion and how much you take in.
It's a very important point. Yes, Dr. Jolly.
So I'm glad you mentioned about that, because you said you're a reverse diabetic. So this morning, every year, Will Diabetes Day, I check my sugar and my blood pressure, and I let the public know.
Mhm.
So this morning, before coming on the radio, I check my blood sugar. It's 103.
Mhm.
My blood pressure is 107/73 with a heart rate of 81. And I did my hemoglobin A1C this year, which checks for diabetes, and it's 5.6%.
Okay.
And so I
Mhm.
I adhere to the plate model as
Mhm.
much as I possibly
Yes.
can. So even for somebody who is like Jacinta said, it's the plate model and these guidelines are for everybody.
Mhm.
They're not just for people with diabetes, because there's no such thing as a diabetic diet
Mhm.
or diabetes diet. But one of the questions I have for Mrs. Thomas is that for people who have limited budgets, particularly here, um, how can we achieve these goals with limited? Because sometimes people complain the vegetables are too
Yes.
expensive, and so they're not able to fill that half of the plate. So that's why perhaps they use it as a garnish.
Yes.
The other thing too is that with the starch portion, a lot of folks use rice
Yes.
as opposed to the local ground provisions, which I am a big fan of.
Mhm.
So how can we make a budget-friendly diabetic plate?
Mhm. Okay, so what I advise, and I use that demonstration at the school level as well when we train our cooks, because you'll hear that a lot, that our foods are seasonal, yes. So what I encourage is that when we have seasonal food, freeze and pack them so you can get to use later on.
Mhm.
In our culture, we use a lot of soups, as we know, and a lot of broths. So a lot of the vegetables, then we can freeze them for up to 3 months or however long we feel like. You label them and you put it in the fridge. Don't leave it for a whole year.
Mhm.
You have to use it up. So that is what I encourage, because a lot of time you find parents or even parents or clients would tell me, well, the fruits and the veggies are very expensive. So then I'll say, okay, give me a list of what you shop when you go to the market. Oh, when I don't go to the market, I buy at the supermarket. What are the type of fruits or vegetables you buy at the supermarket? Oh, I buy the grapes and I buy the apples and I buy the this and I buy the that. And I'm like, well, there goes your budget.
Yes.
There goes your budget, because the imported foods
Are more
are more expensive.
expensive.
And what I noticed, I've done some research on our local fruits and vegetables. Some of them may contain or do contain a lot more nutrients than the ones that we import.
They
in.
must contain it because
Yeah.
because just the method of
The
shipping and the
the
process that
shelf
involves
lives and
the shelf
everything.
life.
Yes,
And
Because
exactly.
the
preservative methods,
guava
yes.
and the mango you
Yes.
pick on your tree in Dominica that is ripe
Yeah.
is much better than any
Than-
apple or
exactly.
grape that is
Exactly.
imported.
Yes. Yes.
And that goes so when you want your apple or grape, eat them overseas.
Eat them overseas or once in a while.
Yes.
In Christmas time, if you feel like treating yourself, treat yourself with apple. But what about our star apples? What about our guavas? What about our passion fruits? What about our guava cherries? What about our watermelon?
So how about eating
So-
it seasonally to reduce the cost?
Exactly.
Right.
Exactly.
Mm.
So that is one of the things that I find that can hinder us in a sense.
I do realize that certain vegetables, when they are in abundance, the price is lower because there's a lot of
Because it's
competition.
buying
around.
No, but
Freeze,
also
yeah.
they're abundant.
And they are
Yeah.
They're
abundant.
abundant. And actually, there's a method to God's madness. For example, right now, for example, you see a lot of citrus.
Yes.
Right.
There's a reason for that because
Yes.
cold and flu season is in
It's around the
January. It starts September,
Exactly.
January. So
Exactly.
God wants you to load up on your vitamin C.
Right now, yes.
Yes.
Yes, exactly. And I had that written down there. So great mind thinks alike.
Yeah.
Mhm.
So, yeah.
I want to piggyback. There's some because there's some specifics I really want to get out of the conversation for the listeners. We're talking. I'm still going to go back to the starchy versus non-starchy vegetables because I think people need to know what these are specifically because a lot of people maybe don't know. And then we're talking about seasonal consumption of certain fruits and vegetables, but fruits specifically. I want a comment from the nutritionist about the seasonal fruits and the glycemic index of some of them, because you started off by talking about glycemic index of some fruits, like you mentioned, banana that might be high, so you
Yeah.
portion it, accordingly. So when people are thinking seasonal, let's think about things like when watermelon is in season when we have an abundance of, well, mangoes. You mentioned mangoes already, but I just want a little, listing of some of our other seasonally abundant fruits and what type of portions. Because you mentioned the bananas, you mentioned the mangoes, but I want a little more in terms of these things that Dominicans have sometimes in abundance. And
Like the
what
pineapples.
pineapples, right?
Sweet,
So what should be the consideration then? So that, and then Dr. Jolly, as I said, the non-starchy versus starchy vegetables, I want to get that as well. I see our phone is going off, but let's get this answer and then we will move on.
Concerning the starchy?
Yes, because you said half the plate earlier in the show. You said half the plate should be non-starchy.
Yes.
And you gave some examples of the non-starchy that
That's
are on the
correct.
plate. But I'm asking, what are starchy vegetables that should not be in that half?
So there are starchy vegetables. So once upon a time, I said to someone, I said, well, are there any vegetables? And they says, yes, there's plantain. A plantain is not a vegetable or non-starchy vegetable. It's so it would be more fit into the starch or the carbohydrate. So there are vegetables that have a bit more starch. I think perhaps like pumpkin and corn. So some people think of corn as a vegetable, but it's actually a starch.
That's why I really want that classification.
So I would like Mrs. Thomas to clarify that, because we speak about carbohydrates and proteins and starchy and non-starchy vegetables, but sometimes we don't understand these terms.
Right.
So can you?
That is exactly why I'm pressing on, because often people will tell you, I'm eating my vegetables and it's corn, and they fall in the plate with corn, or they're doing corn on the cob.
Yes.
So I really want that distinction, because sometimes you can be thinking you're doing
the right
thing.
Yeah. That's right, because some of our starchy foods tend to be sweeter. Those are the ones that sometimes are sweeter, like your carrots, your sweet potatoes. Although we will tell you as well, sweet potatoes is especially for diabetics, good for diabetics, good for your eyes and stuff like that. But then pineapples and bananas, mangoes, sometimes apples, and you have the fruits that are very normally sweet fruits. So these ones would fall under our starchy. The ones that will not would be like your cucumbers, your tomatoes, your broccoli, these ones, because they have less sugar. So you would find that you can consume, and these are very watered. These are water fruits and vegetables, some of them. So then you can eat more in abundance of them. And again, it brings us back to the GI, to the glycemic index. So you will find that you're eating carrots, which myself and the doctor and the pharmacist will tell you, or even you, Trudy, anybody will say, well, since we're small, we know that carrots is good for your eyes. Yes. Carrots is also high in sugar.
Okay.
You know what I mean? So the knowledge about these things is what we have to put out there for the public. And may I just plug this in? I am a very huge fan of this program. And I really think that it brings a lot of awareness and knowledge, having the doctor, the nutritionist, the pharmacist, yourself, bringing the knowledge, because a lot of times we do things because we don't know better. So this platform is a very good platform where we can come and share the information to the public. So, I mean, and nowadays we have Mr. and Mrs. Google. So if you're out there and you want to get a list of all that, you can just go there and Google your starchy fruits and vegetables, and you can have a listings of it, which will make it better for you to guide yourself at home in making the right choice, the better choices.
I have one other question. There was an article written last week that urged, it's on Dominican News Online, and it urged Dominicans to take personal responsibility in terms of managing their diabetes. And I do agree that there's some level of personal responsibility when it comes to taking care of diabetes. But one of the things that I know as well is that 70% of your health is determined by where you're born, where you grow up, where you live, where you work, the food environment, the work environment, all of that contributes to your overall health. So when we say that, okay, folks who have diabetes or show up to the clinic, that's their personal responsibility, make it sound like that the diabetes it's a personal failure. So and I know, for example, you spoke about the information being out there. We know for a fact, for example, that there's a lot of unhealthy food that gets into school, that is served at school, that's sold at schools. For those students, those children, it's not, they are not yet responsible. Some, we're given money at an age to buy food and drinks when we don't have that sort of information. So I want to know from Ms. Thomas, what is your position in terms of that responsibility, but also in terms of educating the nation's children about food, and also, because when we say personal responsibility, then really and truly we are failing to realize at a macroscopic level the policies that are in place for the schools. Because really and truly the people who are making the decisions for those children are really the parents and the teachers, the principals. That's the level at which the decisions are being made. But also, even here in Dominica and in the Caribbean, there are systems at play that determine what sort of food you eat, whether or not you go to the market. And it's not just information. A lot of people know that the local food is better, but the question is, can they afford it? Can they afford it? Again, it's seen as perishable. So then when they buy the item, it does not last as long as if they buy it does not
processed.
That's correct. So the processed food, it lasts, it's shelf stable, it stays on the shelf. You can eat the can of corn like months later. As opposed to the local corn you buy at the supermarket, at the market. So what role does that play in terms when it comes to nutrition?
I think that's a very good question, and it plays a big role because, for example, with the school feeding program that we have, it's been going on 15 years. We've been working on a policy, and in my opinion, that policy was needed 15 years ago, 20 years ago, because what we are seeing now is what is happening to our children: the obesity rate, the high blood pressure in children.
We're seeing type 2 diabetes in adolescents.
And I do hope that those that need to hear this is hearing this. We need the school nutrition policy to be implemented, because what I find, I go to 45 schools around the island, and every school is run differently according to the principal. Now, if you for it, you for it. If you're not for it, you get the point what I'm saying. And this is the problem. These are children that we are dealing with. We have to be the voice for the children. If we don't put policies in place, I can go to the school every day, Monday to Friday, and said, make better choices. But if we doesn't have a policy implemented, it doesn't make any sense. And this is where we are right now with the school nutrition policy. And I do hope that we will get it, not 2026, but 2025, meaning that we need it. We desperately need it.
Well, here comes the question again of personal responsibility. Even our previous host used to say that your health is your responsibility. But the reality is that a lot of it isn't. It really isn't. Because we're looking at the microscopic, we're looking at the individual. So that teenager who goes to the clinic and who is diagnosed with type 2 diabetes, that was not their choice.
That's not their choice.
That was not their choice. They went to a school that served...
The food was provided
provided for them, whether it's episodically or regularly. And sometimes it is French fries and fried chicken, meat pies, or some very lacking in fruits and vegetables. There are shops around the schools.
In the schools as well.
In the schools.
In the schools as well, being sold by those in authority. So you give a child money for lunch and you say to buy a lunch. A child is a child. That child can't be held responsible. It's you, the parent, or the ones at school providing the schools.
So
it's not a question. It's not a question of personal responsibility. We can provide the information. And yes, we want folks to go there and to make those changes. but there's lots of socioeconomic and policies
Policies,
Mhm.
yeah.
that are at play
Yeah.
that
Mhm.
prevents, because okay, so
No. I was just going to say. No, I was just going to agree. The socioeconomic
the
determinants
policy
of health
that
are
is at play.
are major, and anytime you learn about these factors, you see this skew is always on the side of the socioeconomic determinants of health. And so oftentimes, what people don't like to take that into consideration. Often people do like to play the blame game sometimes. So I'm happy that this discussion is unfolding. I also wanted to say, Mrs. Thomas, as it relates to the school nutrition policy, as someone in education, I can tell you that it's very true. Not only is policy important, but actually implementing, enforcing, and supporting policy.
Exactly.
And we have an issue with following rules in Dominica. This is just
So it's
this
not
is just what it is.
So it's not just creating the policy.
No,
It's
because then when you
Implementing the policy.
when you have the policy in your hand, people have to be stewards of the policy, and it
Yes.
actually needs to be implemented. And I
Yes.
can tell you, this is where the
Where
difficulty is.
is.
So if you think it's difficult to get the policy implemented, then start to think
Yeah,
about
to get it written.
to get it actually, to get it written.
Yeah.
When it's actually there for the schools to take up, oh my God,
So,
it's
so do you think we should go the way of policymakers, or do you think we should go the way of parents and the students?
has to be mixed.
I think it's
I
both.
think it makes
Mixed,
I think
yeah.
it makes
Yeah, both sides.
Mhm.
because while all those external factors play a role, I was about to say that at home as well, it has to start with education, because even if a parent gives a child money to buy lunch, whether it is in school or out school, and the children are educated as young as they
And the
are,
choices,
you
yes.
talk to them
Yes.
nicely. You
Yeah.
can make their plate colorful. You can explain in their own way of understanding which foods are healthier. Then as they get older, they are educated
habits,
enough, and
yeah.
right information has been passed down to them for them to make wiser choices.
Yes.
So yes, all of those external factors are there. They are present. They do have a part to play in poor food choices, but still it's also has to do with home education as well.
But
There's a-
we bring up this subject and we talk about giving children money to buy food. And here is the one thing. Look here, you can bring your food from home.
Oh, yeah, that
You know
too.
what I'm gonna
Yes,
do?
of
If I was a kid in this day and age and my parent was giving me $5 or
Take your
$10
money.
every day, I'm gonna go, I packing up my bread and whatever it is,
Keep
put
the
up
money.
fruits, and I'm gonna keep that money for something else.
Mhm.
I'm gonna bring my food to school every day, be like everybody else, and then when it's time come around
Christmas.
You have your money.
or whatnot, that's
Yeah.
right. I got my money to buy exactly what I want.
That's what Dr. Burnett was saying last
Last
week.
week, right.
Yes.
Or the other thing too is that you can save it up for your education or a lot of different things. So you gotta be smart, because the reality is that because the thing is that the kids eventually grow up, they become adults, they go out into the workplace,
Mm.
and many of them do the same thing.
Of course.
Same habits,
They follow the same habits of purchasing food outside of the home
yeah.
and not saving up their money to
To the long run.
that's
Mhm.
it, yes.
Let's take a call. I know some people have been trying to get us, and then we'll take a break to give out our package that we announced at the start of the program. Caller, good morning to you.
Yes, good morning to you.
Good
Trudy.
morning.
Hi, good morning.
Yes, and I'm listening to you all, and I heard somebody talk about somebody who buys stuff, they buy apple and so on. And when I heard apple, some years ago I heard about how nutritional is guava, and I started eating guava any and everywhere I see a guava, I would pick one, pick two, because it is what I heard is more better than the apple, which is more advertised. And one of the other things I think that could happen is teaching making better choices. Things like guava trees could be planted somewhere around in the schoolyard, or maybe one or three guava trees, and to have children to teach children if they will go to pick the guava. You know what I mean? Another thing is, I believe maybe a competition in the schools for children coming with the most nutritious research and so could win a prize for the year. So something like that would maybe encourage children to make better choices. Good morning, listening.
Good morning. Thank you, caller. Interesting points there. Interesting suggestions for school-based improvement in nutrition. Yes, Jacinta.
But and we have to be careful with guava as well. As nutritious as guava is, too much guava can cause constipation. So can you imagine someone who has already had difficulty in going to the washroom, and elderly? So just be mindful again. We're talking about
Moderation.
proportion,
Moderation,
choices, and
yeah.
moderation. So just keep that in mind.
Yeah, let's take another.
But of note, though, I learned
Mhm.
too much pineapple causes diarrhea.
Okay.
Too much
so you
mango
see,
as well. So if you mix
ask
the
for too much mango.
if you mix
know,
it,
right?
if the, you mix the
I'll
two
put
of them
paper.
together, then
Get a
Mhm.
balance.
yeah.
Mhm. Let's take another call. Caller. Good morning.
Yes, me again.
Mm-hmm.
Do not knock guava or mangoes talking about the great contribution. Because when I was younger, we would, on school holidays, we would go up in the guava field and the mango field and eat for the whole day. And nothing happened. I attribute me eating a lot of mangoes and guavas to my health. Because when I get a cold, I maybe get a cold every 3 or 4 years,
Mm-hmm.
and I attribute that to the things that I ate when I was younger. You understand me? So that's what I'm saying. So don't knock the guava too much
It's
because there
it's
are people.
nutritious, but you're just saying there may be that, just like people use guava leaf when they have diarrhea to stop the
Right.
diarrhea.
But you see,
So they
True, well, the guava leaf and diarrhea is very good because once I had diarrhea and I started chewing guava leaf, because
and
I
it
was
went.
and it stopped eating the young guava leaf. And then, we need to give the children the choice, like maybe like fancy me things around the food. And it was really good for me eating all those things when I was young and for me not to be that sick now.
Mm-hmm.
Right? Thanks, I'm
Mm-hmm.
listening.
Thank you. It's just balance. It's just all about balance,
And the other thing about it is that when we were growing up and we eat those food, we were very active.
Mhm.
We running, we play in every sport, we
Yes.
always outside. But nowadays you find that children are not that
that
much
active,
active like
they
we
use
used to be.
technology,
Yeah.
mostly
So
on
all
their
that matters
phones.
as well.
Mhm.
Right.
Let's take another call. Caller, good morning.
Hey, good morning again.
Hi.
Yeah, earlier on, I heard the nutritionist mention about a policy at school for
Nutrition.
diet,
Mhm.
nutrition. That has to go a little further, even in my opinion, at the hospital.
Okay.
Because I've seen things there within the past years that really is not right. You have patients there, for instance, diabetic patients, and a diabetic patient is actually fed the same meal like everybody else, not based on their condition, and I think that is appalling. Where you cannot, and I've seen that with my own two eyes. I have taken pictures of what was served, and what was served is diametrically opposite to the condition that the person has.
Mhm.
And more than that, just a couple of months ago, I, with my own two eyes, saw and with my ears heard a nurse selling snacks on a ward to patients. And I saw that, when I saw that, my inside turned because I figured that's a person that should know better. And this person was not selling healthy food. Just not selling this packaged snacks. Right? They may buy it by one of these outlets that buy it wholesale and come in and retail it on a ward at the hospital.
Mhm.
These are the things that are happening. So there's no port. That tells me that there is no standards and no policy in place for that to be happening. Because a nurse cannot be selling unhealthy snacks at a hospital for people who are trying to get better. You don't know what their conditions are and selling this sweet, sugary, packed with all kinds of stuff that we cannot even pronounce the words in, and serving that to patients that's on a bed with serious conditions. And these are the things that I want to agree with the nutritionist about the policy that needs to be decided, like yesterday. Don't wait for next year. That has to be done like now, because it was supposed to be done already. And that's where we have to create those systems in place to really curb what is going on. Because I don't want to talk from even my daughter's perspective. I heard Dr. Lisa said if parents giving their children money, the children should be saving the money and going with their snacks and whatever. That is true, but at the same time, if they don't know better, what the parents do, they would think that is the norm, that is what it's supposed to be. I never send my children to school with any snack, any packaged snack. we prepared real food. And I'm going to tell you something. Not at a preschool level, not even at a primary school level. At a high school level, when my daughter was in second form, I think, certain times when she opened her container of food to eat, that children that was watching certain vegetables and asking her, what is that? Second and third form, what is that? Because they didn't know certain things. So when they saw an okra or string beans, they didn't know what that was. Because they were never exposed to that at their home. And it was appalling that at that level, children didn't know certain things that we actually grew here. I don't go in the supermarket and buy nothing in a can, you know. Dr. Lisa, if you are the market every Saturday, and that is a person that tells me you have good foundation. And there are people that don't know the farmer's market. Everything is in the supermarket. I don't know if it's because of where I grew up, but my food only comes from the farmer's market. 96 to 98% of what I eat is plant-based. Everybody cannot be like that, but at the same time, make an effort to do something to eradicate all these conditions. Have a good day.
Thank you, caller. Yes. So the caller made reference to packaged snacks, and the overall point about policy even needed in the healthcare system. I guess that point is well taken.
Yeah.
But he alluded to the sale of packaged snacks being unhealthy snacks. Packaged snacks, unhealthy, full of sugar and other things, and Mrs. Thomas, I see you have some packaged snacks that you brought to us. So I wanted your take now on the nutritional value in some of these packaged snacks that oftentimes people do sell, yes, but also give to children for their snack during the day at school, whatever it is. So I see you have some boxed drinks there, and you have some packaged chips. So what is your take on that?
Tell us about it.
Okay, so one of the reasons why I brought this morning, and I know I was able to show it to the audience, is to let you know these are food. These are food items.
So she's showing a banana and a cucumber.
Apple, a cucumber. So you get the idea, a carrot, a tomato. These are food products. These are food products. These are not food. These are food products.
So now she's showing the potato chips and the...
Yeah, so that's why. So this is why I go to the market.
Yes,
Because to buy food.
Yes.
Because you see here, nobody has to tell me that it's a cucumber.
Yes.
I recognize it as a cucumber.
Yes.
There is no label on the cucumber.
There you go.
There is no label. As opposed to the food product, there's always a label because the food product has been made in a plant, not by a plant. In a plant.
What is in there?
A manufacturing
we don't even know.
plant.
Yes.
So rather we should eat foods that are made by
Grown,
plants.
Yeah. Grown in whole.
And
yeah,
but the other
exactly.
thing too is that we don't understand here that it is I don't know if it's a privilege. It's a privilege.
It's a privilege, yes.
To be able to go and to choose your cucumber,
your carrots, or your lettuce,
Yes.
or whatever the case may be. Yeah.
because it has come from the farmer, from the farm. And it comes to the market. You buy it at the market. It would be even nice to get it right at the farm itself. Sometimes you have that
in your backyard.
It could be in your back, or you could go to the farmer, because some people do allow or they live close to enough to farms, and to choose your own produce.
Yes.
And now there's this whole movement in restaurants called farm to table. Farm to table. So if you shop at the market and you buy local food, it's farm to table. It's farm to table.
Yes.
And so, people going out to restaurants and say, oh, they had farm to table.
No.
Guess what?
You can do that at your home and be on trend.
Exactly.
Yes.
And that too is farm to table. But one of the things I want you to take a look at is the amount of sugar that is in these little box drinks. So this little box juice we can see here, it's a guava pineapple juice drink, which you commonly give to a child. The serving size is one box, and one box has 27 grams of sugar. and it says includes 20 grams of added sugars. So the question is, how much sugar is there in the box?
That's 90 spoonfuls
So you
at
add-
least of sugar.
So you add the 27 to the 20?
Yes.
Really?
Yes.
I thought you said
Because
includes.
it tells you the, and even if you take this probably, if I try to taste that, I know I will bath. It will upset me. That's how much I don't take added sugar. But the added sugar, sometimes they have dyes in there.
Yes.
They have all kind of preservatives for the shelf lives. So when you take this and you give this to a 6-month-old child or 1-year-old child, that child is going to develop a taste for these things, because that's what those things do. You get addictive to them. So you wonder, why is it when you give a 1-year-old child a box drink, and right after drinking it, that child is so hyper? That's because the amount of that child has taken sugar that could last her for a lifetime, or him for a lifetime. And that is why it's very important to read nutrition fact label on food products. As doctor said, you don't have to read no labels on an apple. You don't have to read labels on a guava or a pineapple or a slice of watermelon. So that is the whole idea. Choose foods that are wholesome. Whole grains or wholesome food, instead of choosing food products. I'm not going to tell you that I'm a food police. If you want to have that on your birthday, when you continue your celebration, that's fine. Once a year, once every 6 months. But you cannot be, for example, I go to schools, and I remember a teacher telling me that a child comes to school every day with a particular sweetened beverage that is bought in the store every day, 5 days a week, and a particular sweet biscuit or snack, whatever you want to call it. So imagine that child is having that 5 days a week, every day for lunch.
At home as well.
So it's not surprising. So it's not surprising then at 16 years old, or they become teens in the early 20s, they have diabetes or type 2 diabetes.
Not even 16. I'm seeing it at 13.
Wow.
A child at 13, and doctors are ready to put her, because there's no other choice. If the parents doesn't want to follow, like to change the child's diet, then the doctor have no choice but to put that child on medication to mitigate, her illness. So that is where we come in and we tell you, drink your water. We sell local fruits in local juice in Dominica. These juices are packed with sugar.
Yes.
You hardly even get the taste of the guava or the pineapple or whatever it is. So as much as we want to say our health is our own responsibility, I believe also the people out there providing these foods to the community have to be held responsible as well. Make better choices. I will buy your juice if it's unsweetened. Let me know where you're located, and I will come by and buy a bottle of cane juice like I see because it's good for you.
Let me take a question from one of our listeners on social media, asking about the use of honey. How much should one use? Of course, oftentimes people try to replace sugar to sweeten their beverages or their foods, and they use honey. I want to add to the honey question about the artificial sweeteners as well that are often used to replace sugar. So your views on the use of honey and quantity, and also the use of artificial sweeteners. So that's my question to you, Mrs. Thomas, and then Dr. Jolly as well, if we have time. Yes.
From what I know, honey it's kind of like the same like sugar in terms of it's 4 grams in a teaspoon. So it's a natural sweetener. A lot of times we think of things natural, we can eat more of it, but again, everything is in moderation. So just because it's natural, just like mangoes, like I can during the summertime I can eat like 6-7. I can have mango eating competition season, But same thing with pineapples. Just because yes, it's a food, but you still have to eat it in moderation. So you can have some of it, but you can't have all of it.
And you know what I've learned just during the Independent, they had I think the theme was honey or bees or something like that. And I saw the demonstration that all honey is not actually honey. Some honeys, they add sugar to it.
Yes.
So there's a way that you can tell if it's
Pure
honey. So that we have to be very careful with as well.
Okay.
And what
What's the way to test to see if you can?
I think tell me about Point it
It's
in
the water. It's
and
if it will is how it will behave in
dissolve.
water. So we
Yes.
can maybe get there was a
The honey
demonstration
person,
shown.
there was a demonstration.
Yes.
Yeah.
It was about adding water and seeing it, the behavior of the
Of the
honey.
honey.
But
Yeah.
another thing that has often been taught too is that yes, honey is, the equivalency of the fructose, which will then, be converted into the glucose is there, but there are just some added what you call it, vitamins
Benefits,
and
yeah.
minerals from consuming the honey as compared to white sugar, let's say. But it's not that the glucose conversion will not occur, and you will not still, if you have a lot of honey, be raising that. And the artificial sweeteners, quick comment.
That's a no.
That's a no for you.
I don't recommend it.
Okay.
I just feel like because of the additives in there and all the preservatives and whatever else they put in there. It's just like, okay, let me give you a quick example. If a client comes to me and they said that I love my Coke, a lot of people's addicted to Coke. But some people think that if they drink Diet Coke, that there is less sugar addiction. No, I would rather that you drink the regular Diet Coke, because the one they tell you that is
you mean the regular Coke?
The regular Coke. The one they tell you that is sugar-free or diet or whatever it is, these ones are packed with more dangers to you.
Okay.
Yeah.
So you're
okay.
Okay. All right. We also need to, we're going to take a call because we need to give out this beautiful package that we have in studio meant to assist with managing diabetes. And we want the caller that wins this package to be able to answer a question or maybe two about what we've been discussing both this week and last week, because we've been focusing on diabetes. So now is the time, as we're about to wrap up the program, to try to win the package. There's a glucometer in there, blood glucose monitor. There is some Lancets, Glucerna, which is meant to not spike your sugar. It's a very specially formulated drink. There's cinnamon tea bags there, and there is also the 7C's 7C's product in there. So big package. The person and the phone was ringing off the hook. So I need to get someone who is going to answer. Yes, do we have someone? Okay, we lost you. So let's see. Yes, caller, good morning.
Good morning, darling. How are you
doing? Hi, good morning. How are you?
I'm doing fine.
Okay, you ready to win the package?
I hope I can, because I know I have somebody to give it to.
Okay. So I have a question. I don't know if Jacinta wants to modify it or Dr. Jolly wants to modify it, but last week on the show, and I know you are a regular listener, Dr. Jolly mentioned some of the risk factors for developing type 2 diabetes. What puts somebody at risk for developing type 2 diabetes? I want to know if you can tell me at least two. Yes, at least two risk factors for developing type 2 diabetes.
That's a nice question.
No, well, I think they spoke about maybe obesity, a lot of high sugar content food, and how we call it, lack of drinking water, too much sweet things. People eat a lot of sweet things.
So the high sugar diet.
High sugar
okay.
Food. People should avoid that at all costs and eat more food that will be pleasing to the body.
Dr.
Not to their taste buds.
Dr. Jolly, what do you think? Are we giving her that's two, or are we giving that as one?
It's a tough one. We have to vote on that, but I do think she has right. In terms of yes, high sugar content in foods, and she mentioned another one.
She mentioned obesity.
Yes, obesity.
So we're giving her the two.
Yes.
Okay. Look, the consensus is you've won.
Thank you very much. Beautiful lady.
So congratulations, Blue. You've won yourself a package. Well, you say you're going to give it to somebody. How does she get it? Just in
Yes, I'll be giving it to somebody, and I hope that person's going to put it into good use.
So she can. Which branch is easier for you to collect it from?
From the Rosa branch, obviously. From okay, my boy not there, Carlton not there. I long to hear Carlton's voice on the radio again.
if
Anyway,
would
I'll collect it at the office on King George of Street.
okay.
King George V
So
Street
what
branch.
we'll do, we'll hold it in the dispensary section. So that's downstairs in the pharmacy area. Give me
Yes,
your name,
and
please.
Mistress, what's her name again? Our long.
Dover.
Dover, yeah.
She knows me.
So
Mr. John Baptist not there.
what is
Mr.
your
John
name,
Baptist
please?
at Portsmouth. So I'll collect it
Okay.
there.
What is your name, please?
Faithful Blue.
Miss Dover know her.
No problem. Congratulations to you. So at your
Thank
convenience.
you very much.
Yes, thank you.
Okay, so congratulations. We
all
had
right.
to give out that package. But yes, I know Dr. Jolly had spoken last week as well about the risk factor of the what you call it, the family history, the diet, being poor, the inactivity, physical inactivity.
Right.
Yes, so we spoke about those
History of
things.
diabetes in pregnancy.
Yes,
Right.
gestational diabetes. Yes. So I was looking for some, but anyway, she gave us two. She gave us two, and she has one. So that's very good. And I hope our other listeners, of course, have been benefiting from the information that we have been sharing. I do see some people saying the show was very informative.
So yes, so as we continue to observe diabetes and remembering, sorry, all the patients who are suffering from diabetes, it is a collective effort. As Mrs. Thomas mentioned, she's not going to disregard what your doctors have educated you on. She, along with doctors, pharmacists, other healthcare providers, will work with you, and you also play a crucial role in your management of diabetes. And just quickly before we leave, some people have the misconception that once they are on medication, that they are free to eat what they want. But again, it goes hand in hand. So the medication on its own is not going to control your blood glucose levels the way you want it to. You have to put in the physical work. You have to control what you eat, how you eat, when you eat. So keep that in mind. And like we mentioned earlier, the guidelines on the portions and what is healthier to eat is for everyone, not just persons suffering from diabetes.
And I started off by asking, for someone, that was the first question I asked, someone just diagnosed with diabetes that may feel that the condition is going to restrict them so significantly and might be, mentally distressed about the diagnosis. I just want to say that I hope the information here has shown how, portion control, moderation, and not necessarily just restriction can go a long way in managing the disease. I know some people, health gurus will say, think about what you can add instead of what you can subtract. So add more drinking water, drink more water. So think of it as addition, drink more water, eat more non-starchy vegetables. Don't think of, I cannot have, and I cannot have, and I cannot have. So think about what you can have. And I think, mentally that has a better impact. So Dr. Jolly and Mrs. Thomas, closing words as we wrap up the program this morning.
I'll just go by saying in everything that we eat in moderation. And remember to include the other aspects of nutrition, which is the breathing fresh air, sleeping, exercising, being happy. Don't always be angry. That takes stress on your body.
Managing
Stay
stress
away from
levels.
stress. Keep your stress levels down. And remember, we are on the nature island and we have the foods. We also have the food products, but I would encourage you to choose the food over the food products. Thank you.
Dr. Jolly?
So thank you for having me on the show. Thank you, Mrs. Thomas, for coming out. It was nice to share World Diabetes Day with you. And actually, I was asking Jacinta, I was like, we need a nutritionist to come on the show. And I was actually speaking about, I was like, where's the lady who was on with us last year? So I was looking everywhere. So I'm glad you came out and you made such a helpful contribution. But I'm glad to see these plates as well, which is very helpful in terms of explaining and to showing people. I'm glad that you're here advocating, not only educating, but advocating for changes, systemic changes, not individual or personal changes. I want folks to understand that diabetes or diagnosis of diabetes is not a personal failure. There are systems at place that increases the risk of developing diabetes, and also experiencing the diabetes complications. However, together we are here to support your journey in terms of preventing but also managing the diabetes. And so if there's anything you can do, we can do to assist you to do so, we'll be happy. But I'm gonna sit down at my office, bon santé. So you give me a call at 449-8821 if you need that help. Because I'm
Say the number again, Dr. Jolly.
449-8821.
449-8821.
I'm gonna be there to help if you need so.
Mm-hmm,
I like taking care of the sweet people.
So, of course, you can always reach out to Dr. Jolly. She's given her contact number. And of course, if you need that assistance, with your management, you need that wellness coaching. I think, Dr. Jolly, you do a very good job at that, and how you explain everything so well. So you have the contact information. Don't say you don't. And you can utilize it. Ladies, thank you so much for joining us this morning on Health Vibes. One regular listener and, of course, one staple of Health Vibes, Dr. Jolly and Coralie Thomas on with us this morning. Of course, we'll see you guys again, I'm sure, in the near future. And we are signing out this morning from Health Vibes, God willing. We will be back on next week with another program that will bring a little vibes into your health information. See you next week. Do have a good week.
Take care.
Bye-bye.
Bye.
Johnny's Pharmacy is bringing vibes to it with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen, and co-host pharmacist Jacinta Fagan and Leona Jeremiah. Education, information,